to Transformation in Trials. Welcome to Transformation in Trials. This is a podcast exploring all things transformational in clinical trials. Nothing is off limits on the show, and we will have guests from the whole spectrum of the clinical trials community. And we're your hosts, Ivana and Sam.
Hi, everybody, and welcome back to another episode of the Transformation in Trials podcast. And today we're delighted to be joined by Raj Indupuri, who is co-founder and CEO of eClinical Solutions. Hi, Raj. Nice to have you on the show.
Nice to be here, Sam and Ivana. I'm very excited for the conversation today.
Yeah, likewise, Raj. And we're going to get to learn all about your fascinating background and the work that you've done in the life sciences as we get into the podcast. But as we always do in the Transformation in Trials podcast, we like to center everything around a particular topic. And today, given your experience and background, the topic we wanted to dive into was data, and this concept of data being the new currency of the life sciences industry. Now, I've certainly heard you talk in length about this in the past as we work together, but for the benefit of our audience, why don't you share with us a bit of your thoughts around this particular topic, and we'll kick things off from there.
I think this is a great way to start the conversation. So if you think about our industry compared to other industries, data plays a huge role, whether it's about bringing therapies to patients faster. It's all scientific and evidence-based, right? So it's more objectivity rather than subjectivity. We are striving to bring treatments or therapies for patients, right, for betterment of their lives. And without data and data-driven decisions, you barely can make progress, whether it's the early stages of R&D value chain, whether it's late stages or clinical development. And this is something I've felt about for a long time. And now I feel like the industry feels the same way. And more recently, with AI and machine learning, the possibilities of using cloud and advanced technologies, right? Industry is recognizing this data is the most valuable asset. So I've long believed that data is the currency of the industry, and that's going to be the case. And the recent advancements with how technology is creating breakthrough science, and how data and other analytics-driven approaches and machine learning is contributing to research further validates the statement, if it makes sense.
Makes total sense. And it sounds like you were kind of early in coming up with or aligning yourself with this kind of concept, Raj. Were you a lone voice here, or were there others in the industry that were also talking about this, perhaps?
So when we started this company 10 years back, we anticipated or predicted the amount of data that we are going to collect is only going to increase. Clinical research is going to get more complex. There was significant intent for decades, I would say, to bring precision medicine to reality. And a decade back, when we started the company, digitization was not a word that was used a lot, but we predicted there was significant inefficiencies within R&D value chain, within clinical development, right? And the way to solve, again, this would be by using data-driven decisions. So what we felt, or at least I was really passionate from the early days, right? This is your most valuable asset. You're spending so much money, effort, resources to collect this data. But I always felt like the effort taken by the key stakeholders to invest into the infrastructure that's needed, right? The process that need to be implemented, the upskilling needed for the people to extract and harness value of the data was missing. So hence the premise of the genesis, I would say, of why we started this company. And we had this mission to make clinical research simple and intelligent, by using data and analytics. So it's all connected. So I always believe that this is the currency of the industry. And I'm pleased that everyone is recognizing now. So whether it's me being a lone voice, whether others were saying this, it doesn't matter. But what's important is that now the shift over the past few years in terms of how, again, all stakeholders in the value chain are taking data-driven decisions, are thinking of analytics landscapes, modernizing infrastructure. These are quite exciting trends. And we at eClinical, including myself, feel very fortunate to be helping our customers and being here at this time. And we are excited about what's ahead, or I'm incredibly excited in terms of what's ahead.
Raj, even in the 12 years I've been in life sciences, we have come a very long way towards thinking closer to the data side of things, but we're still having a hard time kicking our paper-based habits in life sciences. Even when we think about clinical data, a lot of them are still conceptualized as clusters of papers that we put together. Yeah. I'm just curious, how have you seen this transformation from paper to actual data points?
Great point. Early 2000s, I would say, right? There was significant efforts to evolve or transform, or mostly maybe I would use the word digitize rather than transform, right? Where, again, if you use clinical trials as a topic, or so there was significant effort in terms of evolving or digitizing paper-based processes to electronic process, right? That's where you've seen rapid adoption of EDC, ePro, or eCover, right? But you are absolutely right. What we have done as an industry is we digitized the process, but it was not transformative, right? And now, the last 3-4 years, I would say, or the last 4-5 years, you're seeing this transformative thinking in terms of how building on the foundations of what was done in terms of digitization, right? How do we actually now take advantage of both advancements with science and also technology, right? How can we actually build on this and take advantage of the advancements and transform how research has been done? I'm pleased to say that, again, there's so much opportunity for providers like ourselves to continue to evolve and innovate. And I would say the same for the industry as well, right? But I couldn't be excited in terms of the progress that has been made over the last 2-3 years. Yeah. And you are right that there's still so many pockets where the industries attempt to digitize, and still a lot of inefficiencies, a lot of broken processes, and where automation and technology can, especially data-driven approaches, can significantly make a big impact. So I think that's the journey we are in, and my prediction is you'll see significant acceleration of this. There is significant momentum, right? That's not only going to be sustained, but acceleration in terms of this transformation using data analytics infrastructure.
Yeah, it sounds like this sort of perfect storm scenario where the problems got worse, right? Because of the data proliferation challenge you talked about. But kind of on the other side of the fence, the technology's advanced too. And both worlds are kind of colliding to create this ecosystem that sounds really exciting, but probably quite noisy. Which brings me on to my next question. I think with kind of problems to solve, it often presents lots of opportunities for lots of vendors. And I think what we've seen in this space is a lot of point solutions to deal with individual problems. There's a lot of debate about point solutions versus platform out in the marketplace. And curious to get your sense on that whole topic and your view on that, Raj.
Over the last few years, right? Again, as companies, biotech and pharma companies, and even service providers try to grapple with this problem, and Ivana, you pointed out in terms of pockets of evolution and some digitization, still a lot of inefficiencies. I my assessment is companies were trying to solve this, right, in a siloed way, because there were not one provider or one cloud that could solve and enable this digitization or transformation across the R&D value chain, even within clinical development, right? So my assessment is companies tried to solve this problem in a siloed way, right? Let's be a little bit more specific within clinical development, right? So companies decided to use RBQM as a point solution to implement risk-based strategies. Companies started investing into just analytics stack, right, for review on analytics. Companies started investing into repositories, maybe one for patient data and clinical data and one for operational data, right? Companies recognized the need to adopt standards, right, and also implement metadata-driven approaches. So that led to investment into maybe potentially MDRs. At the same time, you have computer transformation needs, right? So my assessment, again, going back to what I said earlier, is because of the intent or the need, different stakeholders try to tackle this problem in their own ways. And that led to these silos or fragmented approach of solving the bigger problem through point solutions. But now, what these companies are recognizing is that's not scalable and there is no ROI, right? And also, if you think about the end users, right, you should always think about an end user. Again, within clinical development, you created a fragmented experience, right? Again, let's use a persona or use case or a role, right? Data managers, right? So they have to do review. So they need to access a data management workbench. Let's say they want to use analytics. They might want to go through an analytics stack to do signal detection or cross analytics. Let's say they want to implement risk-based strategies. Now they have to log into an RBQM system, right? It's so fragmented and it causes inefficiencies, even though they might individually provide value. So now I think it's a huge opportunity to reduce this fragmentation and implement platforms, right? So not only it creates better experiences, but also eliminates these point solutions, eliminates the data silos, creates better data flow, right? And again, going back to the early conversation, right? You are now able to give access to different stakeholders, real-time access to this data, single source of truth, so that you can make better decisions faster. With that said, I don't think anytime in the near future, there's going to be one cloud or one platform that's going to solve everything in the clinical development or R&D value chain. So it would be different clouds enabling this transformation or digitization.
And if we have multiple clouds and multiple platforms out there, how do we make sure that for the individual life science company or even across therapeutic areas that we can still share data and make sure that we can have a streamlined process?
Great point. And this is something at eClinical we are really passionate about as well. So at the end of the day, again, if you think about your consumers or R&D stakeholders, right, you have to make their jobs easier and create better experiences so that they can focus on research. And to your point, Ivan, if you have so many different, or let's say, if you end up implementing multiple clouds, right, interoperability and also integration, right, I would say loosely coupled integration between these clouds would be incredibly important. And software providers have to play well in this context where, again, the approach we take at eClinical is there's a huge opportunity for our platform or our cloud to solve different use cases in the value chain. And we have to seamlessly work and interoperability with other clouds. And also we need to build the platform in a way that it can seamlessly coexist within a technology ecosystem of a company, right? So summarize this, I think focus on interoperability and collaboration between different stakeholders, whether it's software providers and also the industry, biotech or pharma leaders will become very important, so that there is significant emphasis on open systems rather than closed systems.
Ivana, I've actually got a question for you, just to sort of mix things up a little bit. Just one perspective that I've heard around point solutions and platforms is, for sponsor organizations, having a platform can be quite attractive versus point solutions because of the additional kind of overhead, validation burden, etc., that having lots of individual solutions represents. I'm curious to get your kind of perspective on that from your vantage point of working in pharma IT.
Well, I would actually go a step further, because it's not about having a platform, because there is no one platform that will take you all the way from early stages of research to commercialization. So in any way or form, you will have to have multiple platforms. You will have to make sure that you can exchange data between them. So you need to build that competency in your life science company for how do we make this all work across. What I see is that we perhaps should stop thinking about applications and think more about the data exchange, both in our own value chain, but also across our CROs, our CMOs, and think how can we look at the data flows rather than the applications that they reside in. And maybe giving that back to you, Raj, I bet you've also thought a little bit about that piece.
Yeah, no, well said, actually. I think I use the word interoperability, and you brought it down in terms of actual data exchange, right? So we hear from customers all the time who have invested into our cloud or our platform that they would need access to data for different reasons you just said, right? So because there's a lot of convergence that's happening, again, within the pharma, real world data, right? Control data, clinical research data, and then commercial data, the need to combine these sources for different use cases. In that context, our customers are demanding actually that they want access to this data in a seamless fashion, right? And that leads to the point that you just made about data exchange. So I couldn't agree more, right? So for us, we are focused on not only providing capabilities to share data at scale, right? But also going back to the earlier comment about interoperability and open systems or open platforms, that leads to that exchange, right? So that you can make it, again, going back to the end users, right? You can make the experience of end users easy if you have this workflows that are integrated, and end users, they don't need to log into different systems to do their jobs.
So I think we probably all agree that not one company can do everything, not one cloud can cater for everything. And with that in mind, collaborations are going to be key across the board. What's your feeling about collaborations in this space, Raj? Because I think collaborate, from my perspective, just to put it out there, is it's one of these topics that's, there's a lot of talk around it, but the actual, when the rubber hits the road, it's very difficult to see what's actually tangible that's going on in that context. So curious to get your views.
Yeah, you are absolutely right. Again, I think if you think about each of our the software providers themselves, right? So obviously each company wants to win big, right? Inherently, you are focused in terms of building capabilities through our lens and through our end user needs. But again, we talked at length in terms of the need to have this interoperability and data exchange. So I think industry has to, again, for this to happen at scale, industry has to push providers, right? And also they do have significant influence. And we see that in our case, right? So even with software providers, you have different sizes and I would say stages. It's not a level playing field. Again, for whatever reason, it's not about the capabilities, depth, or how they work in general, right? Because of sizes and relationships, right? It's not going to be that straightforward where a software provider A can go to software provider B and say, hey, let's work on interoperability or integration. So, and again, it's rightfully, right? So everyone has their own roadmaps, their organization bandwidth is limited, right? You're focused on building your core capabilities. So again, I'm including our company as well. For this to again happen rapidly and also at scale, Sam, to your question, I think industry has to make an attempt, especially the companies, especially the larger ones, to push for this. And also, again, they don't need to be significantly involved or broker this, but at least push in this direction and also be part of this to ensure that what we are working on, what integrations that we want to build will in fact help with that data exchange and interoperability and make sure it works in a seamless ecosystem. So that's one. Two, I would also say that as a software provider or providers, right, they need to recognize, again, we recognize this and we believe in this principle. We'll end up competing, but at the same time, we need to have this cooperation. So we use the word internally, frenemies or co-optation, right? So I think you see this in other industries as well, right? Even large companies who compete, they end up partnering, right? Again, for the betterment of the consumer, or in our case, it's stakeholders and patients, right? So I think we need to accept the fact that there'll be multiple clouds. We will compete in some areas, but there are areas we need to partner and cooperate for the betterment of research and to help eliminate these inefficiencies and to bring these therapies faster to patients, I guess.
I have a question a little bit inspired by what you said, but not directly related to it. Could you imagine a future where life science companies did not actually need to own any software, but where all the computing was in fact done by providers and we only consumed the data? So no management of applications, no management of platforms internally in life sciences, just the end results.
That's very an interesting comment. So let me think. So definitely, I think we are moving in a direction where the need for internal teams to manage applications, right? I'm opposed to completely building, right?
Yes.
I think it's obvious why, because of being the CEO of a software provider. So I think Sam should jump in here as well, because he is very close to these customers as well. I think the build versus buy is definitely waning down, and companies are investing in software service providers and all these solutions rather than trying to build, right? That's definitely a shift that's happening. Two, it's all in the cloud, right? So I don't think even when companies are investing into software, they're doing on-prem solutions. Majority of the cases, there's still cases where they are trying to do it internally, but majority of the cases, they're not trying to implement internally and then trying to manage. So to answer your question, maybe it's a two-part answer. One, technology has significantly advanced, and with cloud computing, right, the need for companies to partner and trust. I would say the trust providers has in, there's, I would rephrase this. There's no reason why companies shouldn't trust providers and deploy software in the cloud and minimize the need for them to either implement or build or manage, right? That shift is already happening. We see that, right? And it's a big shift if you think about it, considering your background, right? So 10 years back or even 15 years back compared to where we are now, right? It's all in the cloud. But IT and tech teams play a huge role because they bridge the gap between the end users and the software providers, right? Again, even that's shrinking. I see some industries and some business going rogue and bypassing IT because they're like, okay, hey, we know what this provides, right? To your point, all I need is a credit card or an authorization from finance to subscribe and get my job done. So, but what you are suggesting is quite aspirational. I'd love for that to happen. But it's going to be challenging. The reason being, here in this case, we are dealing with data. And it's not about outputs, right? There's so many uses or use cases of the data that you're collecting, the legacy data that you have, right? The real world data you have in an organization, right? The use of, again, machine learning on these data assets. So we started the podcast by talking about how data is the currency of the industry and the most valuable asset. In this context, companies, I believe, will not be willing to part with data asset in the way that you are suggesting, so that, hey, let's focus just on the outcomes, right? So I believe that in our case, they want to have a close control of the data, which leads to internal teams still playing a big role in providing that oversight or that management, if it makes sense. I'm just talking out loud.
Yeah, absolutely.
That's a very interesting statement and a comment that requires more thought.
I was just going to say, I think I agree with everything you said, Raj. I think the thing about cloud, sometimes I hear is happy for it to be in the cloud, but we want it on our cloud, not your cloud. And that's a debate that still happens, I think, a lot in Europe. I don't know if that's also in the US, but certainly in Europe, there's a fair bit of pushback in terms of having it within an organization's cloud versus a vendor's cloud.
Yeah, no, I think we didn't even touch the whole area of data privacy and everything, right? So those are not technological problems, right? They play a role in terms of the evolution. So, and in a lot of cases, rightfully, right? Even though you might have capabilities to push everything to a cloud and minimize your footprint, right? That's the end goal. But for a lot of other reasons, whether it's privacy or regulatory reasons, or even the reasons we talked in terms of how this is the most valuable asset, that's actually a very aspirational shift. So it could happen, but I think, again, for that to happen, I think it would be a journey. And before that happens, there's still a huge opportunity with further transformation and further digitization.
Yeah, well, I love thinking out scenarios that will put me out of a job. But also, what you're saying, that sometimes it's not even necessary to collaborate with the internal IT departments, because the solutions that are being offered now, they're so close to the business process and so far away from the core IT competencies. And it's frankly on us. I think it's just 3 years ago, I interviewed a validation manager for a job. And he told me, oh, yeah, well, cloud technology, that's a fluke. We're all going to realize that it's not as safe as having your own servers in the basement. And I was like,
Without cloud, I don't think this company would have existed, right? Yeah. Just back to 2 years back, all we needed is a credit card and AWS account to innovate and to build, right? So without this, the alternative is, I know I talked to a founder and a CEO of a EDC company. She's a close friend of mine, and she was a CEO, I think, in early 2000s. And she said, Raj, we had to raise crazy amounts. And she said, like, I think millions of dollars, even 50 plus million or whatever. And she said the majority of the cost was capital expenditure to build a data center or to work with a data center. Just think about the context, right? How it has transformed our lives, right? And literally all you need to build and innovate is a Amazon or AWS or Azure account.
Yeah.
So I think those statements are not at all accurate in terms of going back, and it's only going to go the other way around in terms of how with machine learning and other things, right? How cloud becomes more important as we progress.
I totally agree. And I think this is a good segue maybe to take it back, Raj, and give us a little bit of background as to how you got to the position that you're in today. Where did it all start for you, and kind of take us a little bit on your journey to present day, if that's okay.
Yeah, no, thank you for asking. So I came here in 97 from India to US, I meant. And my first job, without any planning, right, in terms of my career that I want to be in this industry. So my first job was at a biotech company. Now it's Merck Serono. Back then it was Serono. And I started working as a clinical database developer or a clinical software developer. I just loved it. Again, it has internal inbuilt purpose. And I come from a background where my family had, again, I think it's the case for most of us, right? Dealt with diseases, or you see your loved ones struggling, and then it was a connection. And at that point, it was again completely paper-based process, like Ivana you mentioned, right? Where for clinical trials we were getting FedEx boxes, and then you have two teams actually entering data into two different databases, right? If I can just summarize it, and then you had programs and systems trying to reconcile, and you had data managers using large printouts and markers to do review. It's just, again, looking back, it's just quite fascinating how far along we came, but I think there's still a lot more to do. So I was lucky to be part of that organization. And again, just I can go on and on, but to summarize, then we decided to implement EDC. So that's where the shift from or digitization from paper to electronic process, right? So I was part of that, and I led a technical team. So I just loved what I do, and I realized these inefficiencies, and my background was always around databases. So I always felt like you can help these end users get insights faster, or with workflows, or again, back then reporting, right now it's analytics. You can help their jobs make it easier. So, and we talked, and then from there, I joined a consulting company where we started offering biometric services, EDC, data management, stats and programming. And then when we were working with companies, again, my conviction in terms of how technology, specifically around data infrastructure analytics, can help. Again, I'm using these words, but back then it was a repository with BI, right? And how we have an opportunity to help them take control of their data only got better and bigger and stronger. And in 2012, we had an opportunity with my business partner, Bob, who is now president of the company, and along with a friend of mine who invested, to start this and realize that we want to build this enterprise software to address this data chaos or the data problem. And the last 10 years have been quite exciting in terms of journey, how we started as a services company, pivoted into software company. Now we offer both software and services. I feel really lucky about the team that I have, people like Sam and my leadership team. So It really excites me and enthuses me. Again, it's not easy what we do in this industry, but this continued opportunity to evolve and innovate and to solve problems at scale, that's not changed. And I feel like what we are doing is solving harder problems and complex problems. I believe like as you solve this harder or complex problem, you stumble on more harder and complex problems. It's just the opportunity to evolve and innovate. So yeah, no, I think I'm grateful for this journey, quite an exciting journey. And like I said earlier, I'm more excited about what's ahead.
I think that is a great pass to the next question. What do you think is ahead, Raj?
I think there are a few trends, I would say. One, we talked at length in terms of this convergence of different, I would say, within just a pharma landscape, right? In terms of how different stakeholders would collab more closely, how the data could be used, whether it's real world data with clinical research, control data, and commercial data could be used to solve this inefficiencies with R&D value chain, or help customers or consume or stakeholders take better decisions faster. That's quite exciting. I think the value chain in terms of the analytics landscape, I think it's going to go both upstream and downstream, and there'll be convergence. That's one. The second thing I'm really excited about is machine learning, right? I know with Chat GPT and everything, there's so much, I would say, noise or excitement and enthusiasm, right? The promise of this is absolutely there, right? But to realize that it's not that straightforward in our industry, especially, right? Because at the end of the day, again, going back to the data is the currency, with machine learning, it's all about data, right? Right? If you think about machine learning, again, just to simplify, you need to have data assets, right, to train or for machine learning to work, right? And then you build models. And then in production, you actually use this model to infer and predict, right? Simply put. So again, to build this machine learning models or to train, you need data. And the more data you have, the higher quality data you have, the better your models. In our case, there is significant promise and opportunity, but the challenge here is you don't have these data assets that are readily available or aggregated, right, easily for machine learning. And the reason being, you have every company having their, unfortunately, different, again, even though there's so much progress in standards, right, they still have different variances. We have different therapeutic areas, companies working on different treatments and diseases and devices, right? So the differences in terms of whether it's structures or whether it's the intent of the data that's been collected, it's all over. And also when clinical trials, you're dealing with small data, it's not large data. Even with the phase 3, you're still collecting only small data sets in the context of machine learning. So these are some of the challenges that we'll continue to face, but huge opportunity and upside in terms of how this can be used and how use case can be solved. Again, there are advancements out there in terms of how you can tackle with this as well. So that's number 2, quite excited. And number 3 is again, I would say now companies are recognizing the data infrastructure analytics stack, right? Or the clinical trials infrastructure, right, is mission critical to have and modernize, right? When I use these words, I'm talking about the foundations, right? So again, going back to data, you have all this data with decentralized trials or patient-centric trials. You are going to collect more and more data. There are more modalities, right? So again, to harness the value of this data, you need foundational capabilities, right? Seamlessly ingest this, map, compute, have a very robust data pipelines, right? And have governance built in, right? Have an ability to deliver this for data science or ability to deliver this for data-driven applications. So we hear it all the time from our customers and potential customers that the need to invest into data infrastructure analytics is increasing and it's mission critical. Even though I'm biased with this third answer, because this is what we do, I'm super excited, right? Because it gives us an opportunity as a company and we have a place at the table to have these conversations at a much higher level, whether it's digitization, digital health, and significant transformation with key stakeholders at these companies. And that helps us to learn more, understand more, and evolve and continue to innovate. So I think that trend is not going to, it's not only sustained, but it's going to accelerate it. And I'm excited about that.
Me too.
Well, I think that's a good segue also to the final question that we ask in this podcast. And it's always the same. Raj, if we gave you a magic wand and you could wave it and change one thing about the life sciences industry, what would that be?
That's a great question. And I would say the industry, we need to work on building. If you are a leader at an organizational level, or even if you're a leader or a manager, whatever role it is, building an experimentational culture. The reason I say this is actually coincidentally, I happened to listen to this podcast just this week. I don't know if you watched Tim Ferriss's podcast, and he had Bill Gurley, who is actually he's a legendary investor and one of the early investor into Uber and other companies. And he was talking about how Amazon at that scale, right? Think about Amazon, how big it is. They continue to experiment rapidly, right? And they don't just give up. And if they fail, right? So the point here is like, without experimentation, there is no innovation. They go together, right? And experimentation doesn't mean like you just experiment once and just give up, right? You would fail, and how do you iterate and then continue this? Without that, you would not have AWS. Think about like a online bookstore decided to provide commercial cloud offerings, right, with AWS. And now without AWS, there is no cloud or so. Again, there are other clouds, but they are the pioneers with this, right? And that's one example. It's just because of experimentation and that kind of a culture. So in our industry, I believe stakeholders take too much time for decisions, right? And they are risk averse, sometimes to the point that it actually takes us back in terms of using that regulatory lens, or again, even regulatory bodies are pushing us to be innovative and take risks, right? But unfortunately, if I'm being very honest, right, it's still very risk averse, and which rightfully I empathize why it is the case. So to take advantage of all the things that we talked about, right, to digitize rapidly or transform what we do, right? If you can build experimentation culture, right? Rapid experimentation and pushing your teams to be open-minded, bold, thinking big, right? Whatever roles you have, right? Whatever teams you are, right? I still think that there's opportunities in everything that we do to take bets, risks, and experiment. And that, to answer your question, I would love that. So that would lead to better decisions faster, and that lead to transformational outcomes that the industry deserves, and the industry has the opportunity to do that, and also the patients deserve. Makes sense, if it makes sense.
Makes total sense. That was an excellent answer to the final question. And as we wrap up, Raj, I obviously know how to get hold of you because we work together. But if our listeners would like to learn more about what you're up to and eClinical Solutions, where's the best place for them to connect with you?
So eClinicalSol.com and Raj Indupuri at eClinicalSol.com, my email, right? I'm on LinkedIn, and Again, I should be using Twitter more, but I have not. So that's one of my goals, right? Yeah. So I'm on social media, especially LinkedIn, if you want to connect. And again, my email is rindupuri@eclinicalsolve.com. Thank you again, both of you. And I've truly enjoyed this conversation. And you guys asked some questions that are really thought-provoking to think about our future. And also, again, reiterate the opportunity we have collectively as an industry and the impact that we could make together. So I'm excited about that. Thanks again.
Thank you, Raj.
Thank you, Raj. You're listening to Transformation in Trials. If you have a suggestion for a guest for our show, reach out to Sam Parnell or Ivana Rosendahl on LinkedIn. You can find more episodes on Apple Podcasts, Spotify, Google Podcasts, or in any other player. Remember to subscribe and get the episodes hot off the editor.